I'm Dr. Stuart Copperman, and I've helped develop BabyCise. This exercise program has been prepared and reviewed by board-certified pediatricians who are members of the American Academy of Pediatrics. We and our physical therapy specialists consider the exercises to be appropriate within each development group. However, I'd suggest that you check with your baby's doctor to see if there are any medical reasons not to follow this program with your child. BabyCise is a series of carefully devised and tested exercises that'll help you create quality time with your baby each day as he or she grows from newborn to infant to toddler. Before you do the BabyCise routine, play this video through once or twice. This will get you thoroughly familiar with the exercises and make you more confident when you do them with your baby. If you find it necessary to interrupt your BabyCise routine, you can resume it at any time, right where you left off. However, we'd advise that you review the earlier exercises before starting over. We know that you and your baby are going to enjoy BabyCise. Have fun.
Little one, the world's a great big place. It's full of joy and surprise. Little one, I'll try to keep your pace. I'll care for you. I'll be there for you. Every time I see you smile, I know I want to stay with you. I want to play with you a while. And when I look in your eyes, I see a sparkle here and there. You sparkle, baby, everywhere. How I love to watch you grow. There's something different every day. So many things to see, to know. BabyCise, we're doing your BabyCise. You need your BabyCise. Because I love you. BabyCise, baby, indeed.
Since we can't come in person to your home, welcome to ours. I'm Dr. Bill Crounce, and we're here to show you how you can enrich your baby's life and yours at the same time with the BabyCise program. One of the most important factors in a baby's growth is the interaction between parent and child. BabyCise has been designed to encourage that involvement, but it's more than an exercise program. It's a system of loving, gentle activity between parent and child, which supports the development of a happy, healthy baby. An added benefit of BabyCise can be the development of good muscle tone, balance, endurance, and coordination. It can also aid your baby's overall circulation, digestion, and breathing. It's true that with the help of BabyCise, some babies may reach certain developmental stages more quickly than others. But we're not out to create a competition about whose baby is sitting, standing, or walking first, and we're certainly not trying to produce super babies. We want what you want, a happy, healthy baby. A baby who trusts himself or herself, and you. We've divided the exercises into 5 groups, according to various stages in your child's development. The first group starts right after the baby is born. The emotional and physical bonding between parent and child in these early months is crucial to your baby's development. You can begin this program as soon as you have your baby home. Group 2 involves infants who are just preparing to sit up or are actually sitting. Group 3 is the pre-crawling stage, when baby is able to sit up without assistance. In Group 4, most children are crawling, but each child is different. Some run before they crawl. But every baby must stand and learn to balance before walking. Our Group 5 exercises help develop those skills. The BabyCises here will serve your baby throughout this wonderful and adventurous stage of development. Now remember, these are sequential stages in your baby's development, not a fixed time schedule. Your baby will do all of these things when he or she is ready to do them. Don't push. If some stages are reached earlier because the skills are being practiced, terrific. If not, relax. Enjoy each stage for itself. As long as you know and your doctor reassures you that your baby is healthy, let your baby take his or her own sweet time. And a sweet time it is.
I'm Carla Ferrigno.
6, 7,
And that's me doing my grown-up exercises.
2.
But now I'll be showing you how to baby size. We'll be using our doll sometimes to help us demonstrate the exercises. Our doll is also a great way to show your baby's older brother or sister how to hold the baby and do the exercises. Brother or sister can be involved exercising the doll right next to you and your baby. That way, everybody's involved. Let's start with group 1, newborns and infants. Even the surest of new parents is a little afraid of handling a newborn baby. Sure, they're vulnerable, but they're not as fragile as you think. In fact, to be healthy and wholesome, your baby needs plenty of careful physical holding and attention. Babies need to be spoken to, sung to, hugged, and loved. Don't we all? And that's what BabyCise is all about. By the way, this is how a baby should be held. Or like this. It gives your baby confident support without any strain or discomfort. It also lets the baby see and explore the world around. This gives baby the mental stimulation that's so important. Remember, when you lean the baby forward, the neck muscles support the head. When you tilt back, like this, you have to do the supporting for now. This first exercise is for newborn babies. It can be done from the day you come home from the hospital up until a month later. Do the exercises as long as they're appropriate and fun for both of you. Unless we tell you otherwise, each exercise should be repeated 6 times, but never do them right after a feeding. Also, be sure to note the positions the adults are in for each of the exercises. This position is best for working well with the baby and for keeping yourself fit. Okay, exercise 1. Place your baby flat on his back on the exercise mat. This lets you relax and interact with your baby in the freest way possible. And working with your baby this way will help you moms get back in shape quicker. Work from a position at your baby's feet so you can lean over the baby and the baby can keep eye contact with you. Let him really get to know one of the most important faces in his life. Put your hands on your baby's chest, gently, always gently. Now use your fingertips and move your hands slowly down to the tummy, around the rib cage, back to the tummy, back up the chest, and finally up to your baby's shoulders. When you're there, put your fingers behind his neck and head slowly and gently. Bring your hands back over his chest, down to the tummy again. Now, do it all again. The purpose of this massage is overall relaxation of the upper body muscles and stomach. It also eases tension and increases blood circulation. It'll relieve any air bubbles your baby may have and prepare the baby for the exercises to come. Notice the beat of the music. Sounds like a heartbeat, doesn't it? We know babies relax more when they listen to a heartbeat. Now, with one hand holding the baby's hip, use the other hand to slowly draw the opposite leg out straight. As the baby resists, this will strengthen the legs. Now the other leg. Okay, now, we're going to do some hugs and stretches. Keep your baby on the floor, flat on his back. Grip the baby's forearms. With the arms crossed one over the other, bring the hands gently toward the opposite shoulders. Then, unfold the arms and extend them out to a full spread position. Later, when the baby's older, you can make this a game of so big. Don't lean too far over the baby and make sure the baby's elbows are straight and the arms are out to the sides. Your thumb should be all the way through the baby's palms so the baby's thumbs and fingers can get a good grip around them. The purpose of this exercise is to stretch the chest muscles, to prevent round shoulders, and to encourage lung expansion for healthy breathing. Let's ride the bicycle now. Hold your baby's ankles, then bend and straighten each leg in rhythm, alternating legs. Put your thumbs on top and your fingers on the calves. Make sure they're on the outside of the legs. Be sure to bring the knees all the way up to the chest. Keep the legs in the midline and keep the feet straight. This exercise will encourage spontaneous kicking and stimulate development of the joints and muscles of the legs. It can also help normalize bowel movements by putting gentle pressure on the belly. Next, let's rotate the legs. Baby's still flat on his back. Now, baby's been in a cramped position for 9 months, so don't force this one. Put your palms below the knees, thumbs along the insides and fingers along the outsides. Hold one thigh at a right angle to the hip and gently rotate the leg about 1/3 of the way down. Alternate one leg at a time. This will stretch the hips and free up motion. When you finish this exercise, be sure to let your baby kick freely for a few moments. For our last leg exercise, we want to get baby on his tummy. You can do this by putting one hand across the baby's chest and the other hand behind the baby's head. Then roll over. Now, put one hand on the back of baby's thighs, holding them down. With your other hand, grasp the foot and bend the knee. Do this a few times for each leg. A newborn baby can't walk, right? Everybody knows that. But let me show you something. See that? The baby steps away automatically. Every baby is born with this instinct to walk, and you should encourage it. But make sure that you hold the baby at the trunk and support him firmly. Some doctors feel that this stepping reflex gets lost at a month or 2 of age because it isn't practiced. If you keep practicing, your baby may not walk any earlier, but it's lots of fun. That's it for newborns. We'll get a little more advanced now with the Group 1 infant exercises. You can add these when your baby seems ready for them. If in doubt, ask your doctor. For this group, we'll be using the BabyCise bolster and small baby bell, so you should have them ready. We'll do an overhead reach first. Place your baby flat on his back. Reach towards the baby with your thumbs and let him grab them. You know babies will. Your hands should be over the backs of the baby's hands and wrists. Then gently lift the arms up, one at a time, back over the head and then down to the sides. Stabilize baby between your knees.
I'm gonna do the sit-up. I'm gonna use this one. You just use your hands.
Why are you doing that one?
You'll see.
I'm sitting there.
This exercise is called the upward reach. Let the baby grip your thumbs, then alternate the arms, first with gentle bending, then straightening, pulling up at right angles to the body. It's just like boxing.
Yeah.
This stimulates the muscles and joints in the shoulders, elbows, and hands. These are infant sit-ups. Baby's flat on his back. Now, using the baby bell, place one hand over the baby's 2 hands, which are gripping the top. Notice how baby's thumbs are below the bell. As you gently pull up your baby to a sitting position, put your other hand behind the baby's head. Once the baby's up, gently lower him back down to the mat. You should stabilize baby's legs between your knees. This exercise is great because it strengthens the tummy muscles and improves head and neck control. And it lets your baby get a sense of the difference between his upper and lower body. That builds confidence.
Okay.
Now try the toe to ear exercise. Raise the baby's left foot to the right ear. Bring it down. Then the right foot to the left ear. Alternate left and right. Don't force this. This exercise will stretch the trunk muscles and encourage flexibility. Move your hands across the front of the knees to keep the legs as straight as possible. It won't hurt to keep this one going for a while, especially if baby's enjoying it. Now, here are 2 exercises for the feet. First, put your baby on his back. Bring him close to you. Gently clap the feet. 1, 2, 3, and hold. 1, 2, 3, and hold. Notice how, with the soles touching, the baby's knees are out to the sides. This will prepare your baby for future standing and walking. That's good for mother and baby too. Now we'll show you another exercise for the feet. Place the baby's feet firmly on the mat, close to the buttocks, and allow the baby to push away from you, moving along the mat. That's it. With this one, we're strengthening the legs and hips for weight bearing. These are infant push-ups, and you'll need your baby-size bolster for this. Place baby on her tummy with her chest over the bolster and her arms extended beyond it. Now hold the baby by her thighs and pelvis like this and push gently forward and backward. Forward and backward. This will stimulate the head, neck, and back muscles. Now keep your baby flat on her tummy with her head, shoulders, and arms reaching out over the bolster. Support her under her forearms with one of your hands and hold her buttocks down with the other hand. She'll raise herself up. Terrific! This will strengthen the neck, shoulder, and back muscles. Great to develop good posture for later. Okay, it's time to hit the showers, or in this case, the bassinet. This is a good idea for a cool down after your workout. It also gives your baby some additional important exercise. Hold your baby in the football position. Then hold the baby so her feet just touch the edge of the bassinet. See that? Baby's feet begin to climb. It's the stepping and placing reflex again. It's there at birth and during the stage. Next, lower the baby so her feet touch the water and let her splash. This is good for spontaneous kicking action, which stimulates muscle development. It also increases tactile stimulation with the temperature and texture sensations she feels from the water. Now begin to immerse the baby in the water. Support her at the back of the neck. Be sure to stay in eye contact. Now put your other hand under her buttocks and allow her to float and kick in the water. Now I mean, is that fun or what? You're also decreasing her fear of water. If you're relaxed and splash happy, she's bound to pick up the good, positive feelings you're putting out. Music is great for babies, and for parents as well. Dance to the music with your baby. Hug your baby and love him up. You both deserve it. Your rhythmic motion gives your baby a sense of position and space from a small point of balance. Eventually, this point of balance will be his feet. Okay, as you continue to dance, turn your baby around to the football position. Let him explore the environment. We know now that babies can see right from birth. Look at that. He's secure, alert, and loving it. Now let the baby find the mirror. React yourself. Go on. Make faces, smile a lot. Let the baby see that it's you and him in the mirror. Now, let the baby lean over as far as he can manage towards the mirror so he's raising his back. This will strengthen the anti-gravity muscles in the neck, back, and legs. It also stimulates mental activity as well as self-awareness.
Cause I love you, baby wise, baby and you.
From BabyCise to what we call BabyWise, some practical baby care information we'll give you from time to time throughout the video. What do you do to quiet a crying baby? First of all, check the obvious. She may be hungry or she may need a burp. Does her diaper need changing? If there's no problem with any of these, then here's something to try. Let the baby grasp your thumbs, then hold her forearms in your hands and just bring them to the chest like this. It works almost every time.
This is group 2, sitting, or those infants who are just getting ready to sit. Sitting requires strength to hold the body upright and coordination for balance. Group 2 exercises start with the massage we learned for newborns and infants. This is a good warm-up to get relaxed and to get rid of any air bubbles in there. For this group, you'll need your BabyCise bolster, baby bell, and balance beam, so keep them handy. With Group 2 exercises, unless we tell you otherwise, do each exercise 6 times. Let's start with a big hug.
There you go. That was good.
Sit your baby between your legs with baby's back snuggled up against you. You can do this with a mirror facing both of you if it's convenient. Hold baby's arms lightly, crossing them in front of the body. Then open the arms out to the sides, keeping the elbows straight.
So big. So big.
This will stretch the chest muscles to prevent round shoulders and expand the lungs and chest for proper breathing.
So big. So big. That's good. That's good, baby.
Now let's do the leg split. Put your baby on her back on the mat. Kneel at your baby's feet and grasp the ankles. Spread one leg out to the side, sliding it along the mat and then back to the middle. Repeat with the other leg.
Okay.
This stretches the hip muscles and rotates the hip joints. Here's our baby bell grip exercise. Baby's on her back. You're kneeling, holding the baby's hips between your thighs. Keep baby's knees bent. Hold the baby bell over your baby so she can get a good grip on it. Place your hands over her hands to keep them on the baby bell. Now, pull it down towards her tummy, then pull it up over her head. Elbows should be straight. This allows a range of motion of the shoulder joints. It also strengthens arm and shoulder muscles. Repeat 6 times. Now try the same exercise going side to side. A good rollover exercise begins with your baby flat on his back. You're at the baby's side. Now put one of baby's favorite toys by his side. You can use the baby bell for this. Then raise the arm that's closest to the toy and give him a gentle push from the hips. He'll turn over onto his tummy. Do this one only 2 times. You can vary the side each day. All babies are able to roll from belly to back, and many do it even in the newborn nursery. But it's rolling from back to belly that needs some work. How about a scissors kick now? You should be kneeling with the baby out in front of you. Hold the baby's legs extended straight and parallel to each other, with your thumbs along the inside of the knees and the rest of your fingers on the outside of the knees. Now make the legs kick past each other, up and down. And at the same time, brush them against each other. This is excellent preparation for walking. Let's repeat 6 times. Now let's do the bicycle. Hold your baby's calves with your thumbs on top and your other fingers around the sides of the legs. Now bend and straighten the legs in rhythm, alternating the legs at the same time. Keep the legs in a straight line with the body. This will encourage spontaneous kicking and help the development of hip joints and leg muscles. Next, keep baby flat on his back on the mat, as close to you as possible. Place your hands under his buttocks and put his feet on the floor. Bend the baby's knees as much as you can and gently raise his bottom with your hands to bridge his back. This will strengthen the lower back and leg muscles and prepare the feet for future weight-bearing activity. For this exercise, put baby on the bolster on his tummy lengthwise. Then hold him firmly by his hips. Now, gently tip the bolster from right to left. His arms reach out to stabilize himself. This will increase protective reactions, balance, and coordination while continuing to strengthen his neck and back muscles. Now, let's do some neck and back muscle strengthening exercises. This one is called arching the back. Put your baby on her stomach over the BabyCise bolster facing you. Then, hold her arms out in front and lift her upper body. Hold this for a slow count of 3 and then lower. Up, 2, 3, and down. 2, 3, and up, 2, 3, and down. 2, 3. Here we're helping the lungs expand, improving deep breathing. This next exercise is called Wing It. First, put your baby on his stomach on the bolster facing away from you. You should be half kneeling at the baby's side. Take his hands in yours, draw his arms up and out to the sides and lift them. Wing it up, wing it down. Okay, do it again. Now we're going to use your BabyCise balance beam. Hold your baby under the arms, around the chest, and let her walk the beam. There's that walking instinct again. She's also learning differences in levels and planes, dimensions and spatial relationships.
You want to be comfortable when you exercise, and so does your baby. Winter or summer, if you can, keep your home around 66 to 68 degrees. Even at bath time, there's no reason to raise the temperature inside. Babies thrive in a cooler environment. Excess heat dries up their skin and mucous membranes, and this can sometimes lead to illnesses. You may also want to lower the temperature setting on your water heater. Overheated water could easily scald your baby. The best temperature to prevent scalding is 110 to 120 degrees. We've seen how bath time is a good time to accustom your baby to water. For some extra fun, let him blow bubbles. This will get him started on breath control. But don't try to teach swimming or water survival skills. And never be lulled into thinking an infant is water safe. Don't leave a baby in the water alone, not even for an instant.
This is group 3 now, our pre-crawlers. This is a great time, a very sociable age for your baby. They start showing real definition in their emotions, and there's lots of pleasure, excitement, recognition, and they love to mimic. You cough, they cough. Stick your tongue out. Baby sticks his tongue out. Baby's neck supports his head now. His feet begin to support the body. Baby reaches, grasps, and starts to transfer objects or toys from one hand to the other. It's even more important now to talk to your baby, to read to him and to play with him. Have lots of objects around. Play name games. Show and name objects. Name parts of the body and point to them at the same time. Eye, ear, nose, mouth. You definitely want to use your baby-size sliding mirror with your Group 3 baby.
Look at Gregory.
This is baby's face.
Look at baby.
This is mommy's face.
There's mommy.
Eyes,
There's
eyes,
There's Gregory.
eyes.
Eye.
Nose,
Look at Gregory.
nose, nose.
There's mommy's nose.
Mouth,
Gregory.
mouth,
Look at
mouth.
mouth.
Chin, chin, chinny, chin, chin.
Look at there. Come on.
For these Group 3 exercises, you're going to need your baby-size clutch ball, baby bell, bolster, and balance beam. Remember, you can start this group with our warm-up massage, or you can begin with a game of rolling the clutch ball back and forth. This is a good warm-up routine to get baby relaxed, focused on you and the exercises to come. For our first new exercise called tilt back, have your baby sitting on the mat facing you. Then hold him at the hips and gently tip him backwards, thumbs on his tummy and the other 4 fingers around his waist and hips. Then tilt him up again. See how he tenses his stomach and neck muscles? Now do it again a few times. Now we'll do sit-ups using the baby bell. You should be kneeling, holding the baby between your legs. Place baby's hands on the baby bell and put your hands over them. Now bend baby forward towards you. Then lean him back. Count 1 and 2. See how well the baby balances? Now, swing left and right to the left and right. Next, twist left and right. Twist left and right. Good. Now that we're nice and flexible, let's try some horseback riding. Sit baby facing you and sitting astride the baby-size bolster. Hold baby under the arms, then move the bolster from right to left and left to right. So baby is putting weight on one foot, then the other foot. Do this one a few times. This will increase balance and coordination reactions. Baby will learn to keep himself upright, able to bear weight for when he stands and walks. Now let's ride horseback side saddle. Turn the bolster so the baby is sitting on it, facing you. Hold him at his hips, then roll the baby and the bolster backwards and forwards, and watch him stand. How about that? This is great for balance and weight bearing too. Next, work with the baby-size balance beam.
Let's walk for Mom. Here we go.
Hold baby under the arms and let your child walk the beam a couple of times. Remember, lots of talk and encouragement. This will increase balance and coordination and enable your baby to bear weight when learning to stand and walk. Now here's a new cool-down exercise for you and your baby. Put the clutch ball on the other side of the bolster from the baby. Then let your baby go for it. And get it.
'Cause I love you, baby-wise, baby, and you.
As your baby begins to crawl, safety considerations become even more critical. Your baby's expanding curiosity and new mobility are the joyous gifts of growing, but they can easily lead to parental frustration and irritation, and to dangers for the baby. Let's take a crawler's point of view. This is a new adventure for your baby. But you're the one who must foresee the perils. You should provide a space or room where the baby can roam freely, but make it baby safe by checking electrical plugs and cushioning hard edges that could hurt and injure. Remove small objects that baby could swallow. Obviously, you'll want to keep fine breakables, those family heirlooms, out of this space. Beware of floor-level storage of toxic materials. To safeguard against accidents, always be there to supervise. If your environment is baby-proofed, you can allow the child to explore without fear.
'Cause I love you, baby-size baby in you.
The Group 4 exercises are for babies who are crawling. Life is a bouquet of miracles for your baby now. Every day, every hour, every minute, your baby is learning something about you, other people, himself, and the greatness of being alive. For the Group 4 exercises, we'll be using our baby-sized baby bell, bolster, triangle blocks, balance beam, and a pull toy. Okay, first exercise, sitting position. Have baby grab onto the baby bell. Now hold it and reach down to the floor, then up to the ceiling and down and up and down and up. Now swing left and right and left and right and left and right. And twist left and right and left and right and left and right. Reach for the toes and up and down and up and down and up. This is good for overall stretching, getting loose, and for fixing the baby's attention on your workout together. Now sit your baby facing you. Place your hands over the baby's hands on the baby bell. Now raise the baby bell till your baby is in a standing position. Now slowly come up on your knees and move backwards. This will encourage standing and eventually walking. Our next baby size has baby on his back on the mat. You should be on your knees with baby's feet between your knees.
Look at this. Look. Look at this.
Put your hands under baby's bottom and lift up. Move the baby up and down this way.
There you go. Sit. Go. There you go. Sit. Yes, and down too.
Now take one hand and hold the baby bell behind the baby's head, just out of reach. You're bridging the back while the baby supports with feet and shoulders. Baby has to reach to get it. Okay, let him get it. And remember, lots of talk and encouragement. Strengthen those hips and thighs and go for flexibility. Now we're ready to ride the bicycle. Grab right above the baby's ankles and bend and straighten the knees, alternating the legs at the same time.
There you go. Good girl. Very good. There you go, Sam.
This will stimulate and strengthen all the muscles baby needs for crawling.
You're just a
Here's a good one for your baby's growing independence. Put a clutch ball close to your baby, but just out of reach. Let her come and get it, but not quite get it at first. Move the ball so she has to keep coming after it. A little frustration, a little incentive is good. Now let her get it. Give baby lots of love, talk, and praise, especially in these reward-oriented baby sizes. Now let's show baby how to crawl over the bolster. Place baby with the baby-size bolster under the tummy, hands leaning forward. Gently move the bolster forward and back. For the bear walk, baby is still on all fours over the bolster. With your hands on baby's hips, move the bolster slowly towards you. Gradually, baby will reach an erect position. Repeat this a few times.
There we go.
For this next one, sit your baby on the bolster facing you. Gently pull the bolster forward until the baby stands. You should kneel in front for safety with your hands supporting the baby at the hips. Do this one a few times. We're going to use a pull toy and baby-sized blocks for this next exercise.
Here we go.
Make a tunnel out of your baby-sized play blocks. Place your baby in a crawling position. Now pull the toy through the tunnel. This will coax baby to follow. You'll be giving him the benefit of coordinated foot and hand movement and the pleasure of success, of completing a task. Describe everything you're doing in words. Use your baby's name a lot. 2 other things about language. You should imitate the sounds your baby makes. This will increase confidence. And always relate words to their objects. Toy, point to it or touch it. String, tunnel, pull, and so on. For this one, use your baby-sized play blocks to build a ramp like so. Put the baby bell or clutch ball on top of the ramp. Encourage baby to reach for the toy. Baby will stand using the ramp for support. Make sure baby wins by getting the baby bell or ball. All of this gives your baby a sense of height and dimension and strengthens arm, leg, trunk, and neck muscles.
Okay, come on.
The balance beam is next. Hold baby under the arm supporting the chest. Parents should bend at the knees and not at the back. If your child's more advanced, you can let your baby grasp your thumbs. At first, you'll have to place your baby's feet on the beam, since children don't get this idea of one foot in front of the other right away, sometimes not until kindergarten age. This one's fun for baby, and there's learning too, about spatial relationships, width and height. When it's time for the cool down, you can do the exercises we've told you about already. Be sure to use your baby-sized sliding mirror. It's great for creating a warm intimacy between you and your baby. You can use it for peekaboo games.
Peekaboo, peekaboo. Yeah, where'd Sam go? Peekaboo.
'Cause I love you, baby-wise baby, and you.
When your baby begins to stand, there's a natural tendency to offer support by holding one hand. Don't do it. A child who falls with only one arm held can suffer an elbow separation, which is very painful. Oh, it's easy for a doctor to fix, but it's better for you to prevent it. These are all great American foods, right? Wrong for babies. Hot dogs can easily lodge in tiny windpipes and cause a baby to choke or suffocate. The same goes for nuts, popcorn, hard candy, and grapes. Keep them away from your baby. One last item for this Baby-Wise segment. Never put a baby to sleep with a bottle in the crib. Milk or juice at bedtime can destroy the enamel on the baby's teeth.
This is group 5, standing and walking. This is the age of assertion and independence. New and delightful behavior, good social skills occur. You'll see glee, puzzlement, immense curiosity, even anger and sadness. Your baby may not talk yet, but he or she is communicating. Be especially sensitive now to receiving these messages. Read to your baby.
Open and close story. Oh, open
play music. Practice Scribble Scrabble with bright, non-toxic crayons. Have baby watch you build things. Let baby play with pots and pans. Let baby mimic your activities. Your baby's mind is like a great intellectual sponge now, absorbing everything that you do and say. Don't miss this chance to heighten your baby's learning experiences. For Group 5 exercises, you'll need your baby bell, bolster, and balance beam. Let's start with some hugs and stretches. You should be sitting on the mat with baby between your knees, facing away from you. Grip baby's forearms with arms crossed. Now gently draw the arms towards the opposite shoulders. Unfold the arms and extend them out to a full airplane wing position. You can do variations on this by standing or lying down, like this. Next, sit behind your baby. Take his hands in yours and stretch right, stretch left. Turn right, turn left. To the toes and up. To the toes and up. Let's do it all again. You're kneeling in this one and baby seated on the mat facing you. Use the baby bell for a pendulum routine. Have the baby grab onto the baby bell. Then move the baby bell from side to side like a pendulum. This improves trunk rotation and balance for standing. Let's try a tug of war now. Get on your knees facing the baby. Let the baby grab the baby bell. Place your hands on top of baby's hands to secure his grip. Start a gentle tug of war by moving the baby bell. While the baby tries to get control of the bell, he'll be twisting and turning, raising and lowering his arms. This will strengthen stomach and leg muscles. Now's a good time to bring in the bolster and try a little side saddle horseback riding. Keep holding your child under the arms supporting at the chest. Now move the bolster so baby's side saddle on it. Then move the bolster backward, then forward, till baby moves naturally to a standing position. Do it again. Now, sit your baby on the mat. Let baby grab your hands and pull up to a standing position. Then, hold your child under the arms, supporting the chest, and encourage your baby to walk. Okay, now let's use the balance beam. Again, Hold baby under the arms, supporting the chest, and help baby walk the length of the beam and back. Baby is between your knees with both of you sitting. Grip the baby's forearms down by the wrists with the arms crossed over the chest. Now unfold the arms and extend them out to a full airplane wing position. You can call this airplane and make appropriate noises. Now begin. By now, you may not even have to help your baby do this exercise. He or she may simply mimic you. For this next exercise, you should be standing with knees bent. Have your baby standing facing away from you. Show baby how to tuck his head under, then roll over in a forward somersault. You'll have to help at first. At this stage, babies usually won't do somersaults on their own. Maybe not for several months yet. Do it again. It's great for the neck and back muscles and for increased skill and coordination. Eventually, baby will get the idea and do it alone. Now we'll do the wheelbarrow. With baby flat on the stomach, bend your knees and support the baby under the hips and legs. With baby up on his hands, gently push baby forward. Baby will start walking on his hands. This is really good for upper body strength. When baby seems comfortable with that exercise, try the wheelbarrow on your BabyCise balance beam. Be sure to support baby's hips and legs so that you carry most of the weight. That'll leave baby free to concentrate on hand and arm coordination. When you've done the wheelbarrow long enough, try holding your child under the arms or by the hands and let baby walk the balance beam.
There you go. There you go. That's a good boy. That's it. Another step. Down. Good, baby.
Now let's try a little obstacle course. Using the BabyCise blocks and bolster, set up obstacles between you and your baby. You should be holding the clutch ball and urge your baby to come and get it. When you repeat this one, you can vary obstacles, so baby has to figure out new paths each time. Good physical and mental exercise. A good cool-down idea is to introduce blowing soap bubbles. This will fascinate your baby and encourage movement as baby tries to chase the bubbles and hold them. You and your baby can be a rhythm band, using stuff from around the house, like these spoons and pots and pans. As you keep time, sing your baby's favorite song.
I think that babies are the most important people on earth. That's why I want them and you, their parents, to get off to a healthy, wholesome start.
The future depends on it.
Our thanks to you at home for sharing our home, for watching and listening and caring.
Remember now, pick a time that's convenient and comfortable for you and your baby, and exercise daily if you can at about the same time. If you have to stop the video while you're doing the routines, that's okay too. Just pick up whenever you can.
The main idea is that you'll have for a lifetime the gifts you get and give with BabyCise.
Little one, the world's a great big place. It's full of joy and surprise. Little one, I'll try to keep your pace. I'll care for you. I'll be there for you. Every time I see you smile, I know I want to stay with you. I want to play with you a while. And when I look in your eyes, I see a sparkle here.